Dr. Shabnam Daskar is our Director of Medical Education, and we were having a little conversation about what should we focus on as recordings for our patients this month. It's Movember, all about men's health, and what better place to start with men's health than testosterone. Testosterone is such a poorly understood hormone for men. Everyone thinks it's just to do with sex drive, right, Dr. Carr?
Oh, yeah. The moment you say testosterone, people just visualize a muscular man.
High,
So,
yes, so when they're abusing it, they're thinking high testosterone, big muscles, and low testosterone, low sex drive. Well, testosterone is a fascinating hormone. Please note that it's as important for women as it is for men, but today we're focusing on men because it's Movember. So, Dr. Carr, thank you for making this lovely PowerPoint and helping us increase awareness of the value of testosterone replacement and managing testosterone levels for men.
thank you, Natasha. So, what does testosterone do? As Dr. Iyer just mentioned, we only talk about just a few things, but you can see it's responsible for so many things. Starts with the brain. And Natasha, you and I are more concerned about the influence of testosterone on metabolism, right? Would you like to say a little bit about that?
In our weight loss practice, of course, most people come to us because they're struggling with their weight, and we try to talk about fat and fat burning, but we'll use commonly used terms. And so, yes, when you're low in testosterone, your metabolism is affected. Dr. Carr, you can expand on that.
So, testosterone is, of course, extremely important, particularly in relation to metabolic syndrome. So, when we say metabolic syndrome, it's a problem of belly fat, not enough muscle loss, blood sugars climbing, may not necessarily be in the diabetes range, cholesterol abnormalities, high blood pressure. These are all together what we call a metabolic syndrome. And testosterone levels have an intimate relationship with the metabolism. However, the solution for metabolic syndrome and low testosterone is not just giving them testosterone. So that is what Dr. Iyer and I are going to talk about, because it's not necessarily just because someone has low testosterone, the only solution is to give them some testosterone as an injection or a gel, and they should be good, right, Dr. Iyer? Don't we here get a lot of
How
people
many
who do
patients
that?
Yes, they come in tapping their fingers going, well, I'm taking this hormone. Now, why am I not feeling better? Why is my life not amazingly better? Because that's what people expect. So thank you for introducing the concept that it's more than just replacing the hormone. So today we're focusing on educating you on the role of testosterone in your body and the symptoms of what occurs to you when your levels drop. And then next steps would be a complete attention to all of the things that affect hormone balancing in the body, but we might not get into that today. But today we're just going to talk to you about testosterone and why it's important.
Yeah, and we are going to add a few things about what you could probably do naturally without adding testosterone hormone, because that's obviously a
That's it.
prescription.
Mm.
So, what are some of the signs and symptoms suggestive of androgen deficiency in men? So, androgen is male hormones, and you can see this list is long. So, I'll just spend a little bit of time. So, incomplete or delayed sexual development, that would be in the younger men. Reduced sexual desire and activity, decreased spontaneous erections, breast discomfort, gynecomastia, so that's man boobs, loss of body hair, reduced shaving.
Okay,
Then,
sorry.
yeah, I'm going to pause on that for a minute.
So just to say, this breast discomfort and gynecomastia is more related to the low level of testosterone and the higher responding levels of estrogen in men.
Yes,
It's
and
not necessarily a symptom of low testosterone, but of high estrogen in a man, which is kind of
yes.
complicated to get into. But I will tell you this. I had a gentleman come to me about 10 years ago, and he walked into my office and he said, Natasha, I'm becoming a girl and you'd better help me fix this. He says, I'm crying at commercials. I'm unable to perform in the boardroom mentally like I used to. And I always talk about mental agility and mental flexibility for men. We tease about grumpy old man syndrome, Shabnam.
Yeah. Male irritability syndrome.
Right. And so, but he was saying, like, I am just worried about myself. And when we checked him, yes, of course, his testosterone levels were low, his estrogen levels were really high. And sadly, upon screening, I found that his PSA was quite high. Went on further to check it, and he did have prostate cancer. And when they treat men for prostate cancer, they do not allow us to do any kind of hormonal therapy on men at that point. So he couldn't become a hormone replacement client of ours. But at least the screening for a man feeling emotional, see, his wife was a patient of mine, and so he knew what I do. But it was just very interesting that he came in presenting saying, I'm feeling like a girl.
Yeah, this is so interesting. So, very often we forget that men need estrogen as well.
Mm.
And just as women need testosterone, so we're not talking about women today. So, when Natasha is talking about high estrogen levels in men, the flip side of it, having too little estrogen is also a problem. And it's not that we are going to start replacing estrogen in men. But my point is, just testing for only testosterone in the blood and not doing the whole deep dive of tests that we do, which, by the way, includes an estrogen level as well, does not give us the complete picture. So yes, estrogen is important for men as well. So it's a balance. Everything about, everything about health is actually a balance.
Yes, and you don't want no estrogen. You want some estrogen.
Yes, we want some, but we don't want excess. So this is again some more lists. Now, interestingly, Natasha, you and I had talked about this before. Men have hot flashes too.
That's right.
So low bone mineral density. Now, this is again something that somehow or the other, bone loss becomes equated with women all the time, and we forget that men have bone loss as well with age, right? And testosterone, of course, plays a big part in that.
Mm-hmm.
Hot flashes is something I think even a lot of doctors are not aware that men can get hot flashes as well, right? And then this long list. Now, Natasha, will you just go over these a little briefly, and then I just want to add one comment to this list, the third one, the third slide that we have in front of us now.
So, in my experience over the last 14 plus years working in this field of balancing hormones in particular, um, the most common thing I will hear men say, they don't tend to notice this initiative and self confidence, so they don't self report it as much. They will report some loss of energy on prompting, some motivation changes. They will report irritable mood. I've never had a man come in, okay, maybe once or twice, but feeling sad or blue. But as men listening to this, or women who have men in your lives, which all of us do, it's important to notice when the men in your life, their mood is changing. Dysthymia is um, a sort of low grade depression that's not exactly a depression. So their mood is not as joyful, not as happy, not as responsive, maybe a little bit more withdrawn, a little quieter, that sort of thing. Men do notice concentration and memory issues, but they never relate it to testosterone deficiencies. Poor sleep and increased sleepiness. It's common to have sleep disturbance in everyone that comes to us. So, you wouldn't relate just sleep changes to low testosterone. This mild anemia can show up. I've seen it. It's not common. Definitely reduced muscle bulk and strength. A more important way that men can communicate this is not that they're losing muscle bulk and strength, but they're not making the same gains in the gym. So they're working out, they're doing what they're supposed to do, but they're just not seeing the results that they used to or should for the amount of work. So they have to work out harder. They have to do more as far as physical muscle strength and mass goes. Uh, Increased body fat, absolutely. The beer belly that we tease about, um, pot belly, whatever you want to call it. So sometimes the belt size is increasing a little bit, but they're not noticing a whole lot. And this is interesting because you can store visceral fat, which is on the inside, not the fat that you can pinch on the outside. um, by the time men have significantly lower testosterone levels, than they need, you will be able to pinch fat at the belly, but you'll also notice that they have that sort of swollen belly look because the body fat's increasing on the inside, which is all tied into metabolic syndrome. Um, and then you also want to look, when you're talking about increased body fat, you want to look to see the shape, because most men that come in, their arms and their legs are not too bad. Like, you can still see a bit of their muscle. It's just all around the belly that I'm seeing it mostly. Is that what you're noticing too, Dr. Carr?
Okay, so the interesting thing is when you talk about muscle and men. So my medical practice is mostly in India, and Indians, South Asians, by default, are severely insulin resistant. And the interesting thing is they also have their muscle works differently. So, Natasha, when you talked about belly fat and metabolically more active fat and body shape, very often I'll find, and it's not just my men patients, it's also our relatives and friends who will have, overall, if you look at them, oh, they're not really that overweight. That's what most people are thinking.
That's what I was trying to point to. I didn't do as good a job at
Yeah,
stating.
no, you did a great job. So what happens is, overall, their total weight is not high, but they have more fat at a lower body weight. So that is what we call TOFI, thin outside, fat inside, or some people call it skinny fat, I think.
Mm.
Typically what happens, Natasha, and you may have noticed it as well, but in India, I notice it all the time. Their gluteus maximus, so the back is like the bottom, the muscles in the back are almost not there, so the pants seem to be falling off. The belly is protruding, but because, and they have, sometimes I find that some of these men they don't like wearing shorts because their legs are looking too thin. So unfortunate thing is, just because the total body weight is not high and they feel, oh, I'm not at risk for anything, but what they don't realize is most of them are insulin resistant, so they are pre-diabetic already, which is a very high risk for heart disease and stroke and dementia and everything you can think of.
And more important than cholesterol, actually, when you
Oh, absolutely. Absolutely. I don't think we have time to get into cholesterol today.
No, we don't. But I mean, just to know that, the low testosterone leading to the higher belly fat, you may not notice it because your overall body shape looks almost the same, but your belly is slightly bigger than it should be. Beware that you might be developing your belly fat on the inside. You'll be that skinny fat person, and that is a higher risk for heart disease than even a high cholesterol.
Yes, absolutely. So the point that Natasha and I are trying to make is, just because someone, looks okay in terms of weight doesn't necessarily mean that, because where the fat exists is way more important than the total amount of fat in the body. So belly fat is way more metabolically unhealthy, and belly fat would also imply that there is more fat around the heart and the heart vessels and all of that. So that is one. The other point I wanted to make, from, just based on these symptoms. Now, do you notice that many of these symptoms are also similar in people who are sleep deprived?
That's right.
So increased body fat, diminished physical or work performance, low motivation, depressed mood, poor concentration and memory. Of course, sleep disturbance is a increased sleepiness. Of course, if you're sleep deprived, that can happen. Only probably anemia is not something that will happen. So interestingly, some of the symptoms of low testosterone could also be because you're not sleeping enough. So that is the reason Natasha and I talk about, just because someone comes with a bunch of symptoms and low testosterone, the first thing we recommend is just go and get some testosterone injections or gels, right?
No,
So
it's never the first thing we recommend. And thank you for that point. Because as you can see, there's overlaps and there can be so many other reasons for having those symptoms. It could just be nutritional, it could be microbiome related and digestive health related, it could be brain chemistry related, it could be so many other things because so many symptoms overlap. And here also another point to make is it the chicken or the egg kind of thing, right? Is it the low testosterone that's causing the there's a lot of work that we need to do to evaluate patients, Shabnam. Not that you don't know this, but thank you for bringing it up. That it's about making sure we've covered all the bases in our patients and looking after everything that's related.
yeah, thank you, Natasha. So now this particular slide, which says lab test for testosterone, I just have, three of them written here. But the thing is, if any of you have come into our office already as a patient, you know that we do a much deeper dive, and we don't have time to talk about all of that. But the fact is, just testing your total testosterone level in the blood is definitely not going to give us the whole picture. We are talking about metabolic syndrome. What if your inflammation levels are high? Do we really know that if you have a low total testosterone, that it is actually the real picture? Do we need to do a free testosterone level in you? What does sex hormone binding globulin, that is SHBG, mean for you? So both of us, we are not going into details of all of those, but my point is just looking at, okay, you have this list of symptoms and you have a low total testosterone, so all you do now is just add some testosterone. That is the approach that both of us are not in favor of. So if we talked about sleep, if your low testosterone is because you're not sleeping well, because you have insulin resistance, you're pre-diabetic, and you have high inflammation levels, you are not moving, then just adding testosterone is not going to do the trick. So I'm not going to do a deep dive into all the different tests, but my point is it is much more than just doing 4 or 5 tests at the lab. Maybe add a CBC and just a total a fasting blood sugar. That is probably not going to be enough
Oh
for
my
us. So we
goodness.
do a deep dive in this. That is my point. So what are some of the other tests, Natasha, that you were talking about nutrients? So what are some of the nutrients you would be looking at?
I just wanted to point out something completely different. Uh, One of the things I'm seeing currently are younger and younger men with low testosterone.
Oh, absolutely.
Some 30, some.
Yes.
It's absolutely incredible the number of men that have suboptimal testosterone levels. And, their doctors are saying, well, it's still normal because you're not low. And, men know when they're not feeling well, especially a 30-year-old who's going to take a 28-year-old that I just saw recently. You're going to the gym, you're not seeing the results, you're tired, you know that your mood's not great, and you're being told, okay, but it's normal, it's within the range. And where in the range are you? So, men know how they felt at their prime. And that's the level we want to maintain as they age so that they still feel amazing and healthy. Um, and one of the biggest things, I had a young fellow come in and he said, and his testosterone was crazy low. One of the things he was doing was using a lot of hand sanitizer because he has a little baby. So he sanitizes his hands, I don't know, 8, 12 times a day with hand sanitizer. And I'm bringing this up because so many people use hand sanitizer now that it's cough and cold season. So triclosan is an ingredient in hand sanitizer that has been directly correlated to lowering levels of testosterone. I mean, it's got many other adverse effects, which is why, even though I'm in the medical field, I try to use more natural things as often as I can until I'm at a point where I'm doing something more invasive with a patient and I need, you know, the stronger thing. But if I'm just sitting and talking to people and I'm not touching them, then I'm going to use a more natural hand sanitizer than the triclosan containing ones. But that's just really important. And then to know about other hormone blockers that exist in the environment and things that we're exposed to. So I think we can do another
Yes. And
on
I just briefly
yeah, stuff
mentioned
is
that
going
when we
on.
talked
Okay,
about.
you quickly cover the nutrients then because I can babble. You
Yep.
go.
No, we are going to talk a little bit about endocrine disrupting chemicals when we talk about what can you do to increase your testosterone levels. So yes, that's absolutely on point. So without going into all the details of all the testing we do, some of the nutrients that are extremely important is what I want. One is zinc, magnesium, vitamin D. These are the top 3 that I can think of right away. So zinc is involved with 300 different enzymatic reactions in the body. So if you are low in zinc, and again zinc is something that both Dr. Iyer and I measure in our patients. Now sometimes your zinc level may not be below the bottom end, but it may be nearer the bottom end. And many of you have experienced this. Both of us telling you, oh, you need to take a zinc supplement, which is more than what you have in your multi. But many of you say, but doctor, my zinc is normal. I said, no, there's a difference between normal and optimal, right, Natasha? So many times we've had this conversation.
That's correct.
Yeah. So next is, What are the different natural ways to increase testosterone? This is a very common question I get a lot on Quora. Sleep. We've already talked about sleep. Now, interestingly, there was a paper, I think this was in JAMA. So JAMA is a very well-respected journal, 2011. I'll post the links to the papers with the video as well. So they deprived young men, this is like around 25 years of age, they did reduce their sleep by about 2.5 hours or something for 5 or 6 days, and they found that testosterone levels had reduced by 15%, 1 5. And these were like young men. 25 is a young guy, and they had normal body weight. Everything else was normal with them, nothing else wrong with them. And just sleep deprivation alone reduced their testosterone levels. So obviously, maintaining good sleep hygiene. Now, with sleep, there are two kinds of problems, and we won't have time to go into both. One is if you don't prioritize your sleep. The second is you have problem falling asleep, which is a different problem altogether. Many of you have the problem of not prioritizing your sleep, and sleep is not just testosterone, it's so many different things. So that is one important thing, area where you can look at if you have low testosterone and you're not sleeping well. When I say sleeping well is you go to bed very late at night, you don't get enough, at least 7 to 8 hours of sleep and restful sleep every night. That is important. One more thing in relation to sleep is to rule out obstructive sleep apnea. So many of you have probably heard Dr. Iyer and me asking you whether your wife has ever poked you in the ribs in the middle of the night saying that you stop breathing. So the only way to find out whether you have sleep apnea is, of course, doing a sleep study. But sometimes obstructive sleep apnea can show up as daytime fatigue, or you're falling asleep at the wheel, or you fall asleep while watching television. It could be two things. It could be sleep deprivation also, but obstructive sleep apnea is something to address before doing anything else with testosterone. If you don't have it, fantastic. If you have it, it needs to be addressed.
And the thing about sleep apnea is I'm seeing it occurring in lean looking people. And so,
Yeah.
oftentimes the test comes back and I go, wow, that was just unexpected because they're just so not the ideal picture of somebody who should have sleep apnea. So it can occur in anyone, in young people and in older people. It's really important to sleep well. Another measure of good sleep, if we're saying sleep well, then it's how do you feel in the morning? Are you rested and refreshed? Do you wake up and can you get going? Or are you all sleepy, groggy? Do you need your cup of coffee? Are you just dawdling in the morning and then you get going? And this is for men and women both. If you're not waking up and feeling alert and rested and ready to go, then you need to assess your sleep efficiency, and that's an area we have a keen interest in. So there's so many aspects to look at to restore sleep.
Absolutely. So, yes, so sleep apnea. Interesting, Natasha, that you talk about younger men with sleep apnea who don't fit the picture of being overweight, all those usual things we thought of before. So, this was a recent paper, and I don't remember the name of the paper now. But one of the things that we know is more men than women have sleep apnea. Women have sleep apnea too, but it's a very different picture. That's for another day. But more men than women have sleep apnea, and having sleep apnea, which is not treated, places men at a much higher risk for heart disease. So this was a paper many years ago where they found that 70% of men who had a heart attack had sleep apnea. So if you have had heart issues, definitely sleep apnea is something to be ruled out. So the interesting question was, and we still don't know, there's still a lot of studies going on, whether the testosterone level has any relation to the pathology of sleep apnea, like how does sleep apnea happen, and whether testosterone or other sex hormones have an impact. So this is an interesting question. So the point is, again, if you have sleep apnea, treating the sleep apnea first before increasing your testosterone levels is important. Again, back a few years ago, the guidelines suggested that if you have sleep apnea, you should not be given testosterone. The thinking now is you can get testosterone for therapy, provided we've corrected everything else, if you have been treated for sleep apnea. So you're using a CPAP, and then you can add testosterone. That's a different question and different approach. But the point is, if you have sleep apnea, it's not like you cannot get testosterone at all. That is not the thing. So you can get, but you have to be treated for the sleep apnea first. Now, nutrients, we already talked about. Vitamin D is so important. And again, how will you know if you're vitamin D deficient? Obviously, the only way to know is to measure. But again, in Alberta, we can't measure through healthcare now. We can do a private testing. Anywhere else in the world, you can actually get the measurement done. And until you measure your vitamin D levels, you don't truly know how much you need to take. So that is one important thing. But without knowing your blood levels, can you? So Natasha, would you recommend that people can start off with maybe 5,000 international units a day?
No.
Or without actually knowing their levels?
No.
Okay, I would actually. For 5,000, they're not going to go over the limit. But to know the actual levels is important, because 5,000 may be too little for you. That is one.
Yeah, so I think five, and the only reason I say that is at the start, and I always say this to patients, our practice changes as our knowledge changes and as the science changes, right? And as you can tell, everyone, Dr. Carr spends a lot of time reviewing the medical literature, all the papers. That's why she can just say, oh, I saw this paper recently. It's her job to let us know in the practice and change our things accordingly. But this is obviously something we haven't quite discussed. So I used to tell everybody, take 3,000 to 5,000 drops a day. You couldn't do any harm. And then I started encouraging patients to do their vitamin D3 at the start, or start vitamin D3 and then measure the level. Because as an aside, when it comes to vitamin D3, too high levels and an increased risk of cardiovascular disease is not good. So you want, in people trying to avoid heart disease and calcification of their arteries and things, we want to make sure we're not overdosing on vitamin D. That's just one of the reasons. But anyway, I started trying to get patients to do their D3 the day they come into the clinic. It costs a little bit of money. It's not that much. So I think it's like 60, 70, something like that, right? And it's worth it to do it. But I actually had a patient on 0 vitamin D have top end levels of vitamin D, and I couldn't believe that she was not getting vitamin D from anywhere. And for some reason, so I looked into this a little bit, and it appears that some people genetically have some way of accumulating vitamin D3 even if they're not in the sun. And she does go out in the sun, she golfs in the summer and all of that. But I've always said in Canada it's impossible to make enough vitamin D. I used to say that to everyone. You live in Canada, it's impossible. Well, here was a patient where it wasn't impossible. And so that just changed what I do now. I ask everyone to do it. And if they don't do it at the start, once they start, and I say take about 3,000, maybe 5,000, depending on what's going on with them. But then I'm always checking. I don't ever say to someone, take 5,000 off the bat and then leave them alone.
Yes. So the standard of care that we would like is to measure, but I know that many people don't want to measure here because it costs more money.
That's right. But for this particular nutrient, because too much can also be dangerous, but too little is also very health prohibitive, in that people who are low in vitamin D3 are at increased risk for heart attacks, cancer, autoimmune disease. It's an immune system regulating vitamin. It's really important. But on the flip side, too much is also bad. And so we can't just randomly overdose. I've got people taking 3,000 and their levels are incredible. And then I've got people who are taking 8,000 and I'm like, oh my gosh, you have to take more because your levels are not optimal yet.
Yeah. So the thing is,
and how people assimilate the nutrient that they're taking, and so the dose is always based on your level.
Yeah, that is number one. Number two is, again, there is I have written a longer blog post on this, and I'll send a link to my blog post on vitamin D. There is another variation of a vitamin D which can also rise without the D3 rising. So anyway, we're not talking about details of vitamin D. Yes, the most important thing is to decide what dosage you need to take is your baseline levels. If you are very severely vitamin D deficient, and I get a lot of that from my patients in India, because in India you can't go out into the sun, and the skin color and everything impacts your vitamin D levels as well. So if someone is in very low levels, and I get vitamin D levels in the single digits, so then taking 5,000 international unit a day may not do it for you. You will need a higher dose. But I will never recommend a high dose vitamin D to someone who has not measured their levels. So that is the thing about vitamin D.
Take a little and you'll probably be okay. Taking a high dose without testing,
No. So next is zinc we talked about. Now with magnesium, one of the interesting things that happens is a blood magnesium level doesn't tell us how much magnesium is there in the tissue. So just testing magnesium in the blood, which we do very often, that is not enough to tell us whether you need magnesium or you don't. And magnesium is
I just want to clarify here. Sorry to interrupt you, Shabnam. So magnesium in the blood, because magnesium is such a critical vitamin. I mean, just think that it's important in regulating the electrical conductivity in your heart. It affects that. So too little magnesium can actually, your body will make sure that you collect enough magnesium to supply the tissues, which means your stores are being deficient. So you can test levels, they will look normal in the blood, but in the red cells and in the tissues, your magnesium can be low. So you'll have those symptoms of cramping, twitching, and those are some of the more common ones. However, this is not something we're making up. It is well documented and studied in the medical science that we need to test red blood cell magnesium. So if you do not have a red blood cell magnesium, you do not know if you're low or not.
Yes, but the simpler test that we do is we give you magnesium as a supplement and ask you to increase the dose until a point where you have diarrhea. So it means when you have diarrhea, it means you're getting too much of magnesium. Again, some of you don't have diarrhea even at high levels. It would also depend on which supplement you're taking. So with magnesium, because it is something that should be there from your food, no one can get adequate magnesium from food, definitely. So
I think everyone should take magnesium because really you can't overdose. You're going to end up in the bathroom if you're taking too much. So then you just back down. But the more magnesium it takes to put you in the bathroom means the more deficient you actually are.
Mm-hmm. So magnesium is something that both of us absolutely love. So again, Natasha, the magnesium RBC test is not available all over the world. So that's the reason you and I, we don't usually recommend the testing for every patient, but definitely you will not get into any trouble if you take a basic dose of magnesium. That's one of the supplements that we insist everybody is on. Next comes exercise. So exercise is very interesting. Many of you have heard that exercising will increase your testosterone levels. Yes, that is true. But what type of exercise? Should it be weight bearing? And exercise has way more benefits than just increasing testosterone levels. One of the biggest benefits is to brain function and mood. Those are two big ones. Another interesting thing, Natasha, you and I have talked about women, and those women who exercise a lot, they develop a lot of hormonal imbalances. They don't get their cycles regularly. Now, it turns out that there is an entity in men as well. This is with men who do a lot of endurance training. So they have been found to have lower testosterone levels. Now, how that exactly happens is difficult to explain right now. And again, as always, the solution is not to just give them more testosterone. But the thing is, some men, again, some of these men, they come into the practice. I know you know a few of them who are heavily into exercise and they have a lower testosterone levels than you would expect for their age, right, Natasha? You've seen quite a lot of that. So nutrient depletion is a big one. We see that a lot. And exercising can also deplete you of a lot of nutrients. So if you're not repleting adequately, and repletion of nutrients is not only food, it is food along with supplementation. Supplementation alone cannot do it for you. Food is definitely important. And the last thing that, of course, there are a whole lot of other things, but one of the last things is Natasha had mentioned the triclosan in hand sanitizers. Some soaps also come with triclosan. The other endocrine disrupting chemicals, hormone disrupting chemicals, which have been associated with lower testosterone in men, are the plastic chemicals, phthalates, dioxins. So obviously, reducing your exposure to plastics, particularly in food, in water bottles, that is extremely important. But of course, that is one of the factors. But then that is much easier to do because you can easily trade in your plastic lunch boxes or food containers or drinking water bottles for a glass or a stainless steel. So you can reduce your endocrine disrupting chemical exposure. Another big area is, of course, the cleaning chemicals and all the other things. And of course, a lot of exposure can come from, other things in the environment, pesticides and all the stuff that you're inhaling. Some of the stuff you can only reduce your exposure, you cannot completely eliminate them. But the ones that are in your control, like Natasha talked about hand sanitizer, just check what are the things that are contained in whatever things you're using, whether it's some deodorant, it's perfumes, it is, like I said, chemicals. And oh, another big source of BPA is all these can linings, right? So canned food, canned drinks, of course, we're not talking about food and drinks.
I just want to bring up a couple of areas that are often overlooked. And one is microwaving your food in your Tupperware.
Mm-hmm.
Two, it's buying those frozen meals or the prepackaged meals. And there's a lot of companies that do meal prep for people, especially our busy patients who are into bodybuilding and they access all these companies. But I've noticed that they all come in these plastic containers. And
Yeah.
I'm pretty sure people are heating their food in the plastic. The other thing is that the hot food is being put into plastic. And
Mhm.
so if you have low testosterone, and I'm sorry to say this because the biggest fight I get back from my patients is, do you think I have all day to dedicate to my health? And sometimes it just has to be, you have to make time. But if you have low testosterone, I would advise you to make your own food. Get your food that's low in pesticides, low in herbicides. People who are mass producing food never go to the highest quality of organic food or low pesticide or locally sourced. They're buying in bulk, they're doing the Costco shopping, and I've nothing against Costco. I own a Costco card, but I'm careful about what I buy and where I buy it and what I put into my body and my children's bodies. I have two boys, and I certainly don't want them to fall into this trap of what's happening in the modern world where there's so many endocrine disrupting chemicals, so poor food quality that they are actually still undernourished if we just ate like regular people. So, to me, food preparation, food quality, where my food comes from is a huge priority. And I'm just saying, okay, if you're perfectly healthy and you have no symptoms and no issues, then don't participate in what I'm saying. But show me someone who is that healthy these days, right? Everybody has some sort of symptom. And I made a post on Facebook recently, and a dentist was like, can you prove what you're saying? And I didn't even bother to answer because this is a fairly negative sort of person that challenges everything. But the data is available to support endocrine disrupting chemicals. You just go to Google Scholar, put in endocrine disrupting chemicals, and see how many studies come up. And even as a layperson, you could read this and understand it because they tell you where these things come from. So
Oh, absolutely,
I
Natasha.
can't stress enough how important it is to control what toxins enter your body. Like, I'm taking up extra time here, I know this, but everything that you eat, drink, breathe, be aware. I mean, you can't control what air you breathe, but I have an air purifier in my bedroom and in those of my children, right? And it's just to make sure that we limit our exposure as much as we can so that when we do have exposures, it's not an accumulation of a whole bunch, if that makes any sense. And then
Oh,
about the exercise, the one comment, too much, too little. Patients who have high stress and high cortisol have lower testosterone levels. It also takes a lot more testosterone to make them feel better if you haven't managed the cortisol level. So I don't know if we're having this come up later, but what I want to mention is that over exercising is also a stress on the body. And for when I teach patients about cortisol and things that elevate cortisol, everybody just thinks stress. And many people say, well, I can't help it. Look at the economy. I just lost my job. Okay, fine. That is the stress that everybody thinks about. But pain and heavy exercise are both stresses on the body that increase cortisol and change how all of your other hormones act and work and the levels in your body. So just remember that the more you exercise, in one go. If it's too much exercise in certain people, we're going to see that cortisol elevation and the disruption of the testosterone levels.
Yeah, thank you, Natasha. So that was great. And about endocrine disrupting chemicals, actually, the Endocrine Society, the World Health Organization, both these big organizations in the world have invested a lot of money into researching endocrine disrupting chemicals. And there is Endocrine Society has a 200-page document based on that. So yes, it is a very serious problem, and some of the solutions are actually, they have to come from from a public health perspective, but our focus is mostly on what you can control yourself. So yes, hormone disrupting chemicals are really, really one of the big ones.
I'm going to interrupt you there. I don't know any doctors other than those in functional medicine and naturopathic medicine who are aware of endocrine disrupting chemicals. I'd be quite surprised.
Yeah, you're right. Actually, when I talk about some of this, they're saying like, "Where's the literature?" I said, "Oh, good Lord, just go to PubMed and you'll find tons and tons of it."
Mm.
So some of the endocrine disrupting chemicals are also called obesogens. So they make you retain fat. So that is another very interesting area. The sad thing is a lot of these influences can even start in babies before they are born. So we can go on and on talking about that. Anyway, so next is briefly about testosterone therapy guidelines. So this is the one, a document that came out in 2018, and this is again from the Endocrine Society. Now, of course, this is a very long document. If any of you want to go through it, you can just Google it. You'll find it. It's freely available. Just two things I wanted to highlight in this is we recommend against testosterone therapy in men planning fertility in the near term. So younger men, we will never recommend testosterone therapy because it can make you infertile and testes can shrink. But in older men, now this is where I have highlighted that part, we suggest, so that means in the guidelines, it suggests that discussing the potential benefits and risks of evaluating prostate cancer risk and prostate monitoring and engaging the patient in shared decision making. That is very important. So, this is where the interesting part is even the women's hormone therapy guidelines stresses a lot on shared decision making, and I'm happy to see that the same thing applies for men as well. So it's a shared decision making regarding prostate cancer monitoring and also whether you should be on testosterone therapy or not. That is, again, a personal decision, and you obviously need to have a detailed discussion on the pros and cons. But most importantly, whether should you use injections, should you use creams or gels, or whatever it is, that is a discussion you need to have one on one. And again, in the interest of time, Natasha and I are not going into the pros and cons of each kind right now, because that is a discussion more from a standpoint of what are you comfortable using, what is available in your country or wherever you're living, what is comfortable for you, and a lot of other factors come into it other than just the medical guidelines, right, Natasha?
Absolutely. And the more important thing here is that, okay, I'm going to ask you this question. Dr. Kar,
Mm-hmm.
have you seen recent literature saying that testosterone causes prostate cancer? Because
No.
that is the most common thing that patients get told. When I put them on testosterone, the doctor says, oh no, you should get off of that. It's going to cause prostate cancer.
And women are going to get breast cancer with hormone therapy, right?
Right. But please, can you just
No.
comment on that? Because you're our director of medical education. And so I want to hear it from you.
Oh,
I
again,
want everyone to hear it.
the brief answer is no, that is not entirely true. But at the same time, if someone has active prostate cancer or recent treatment for prostate cancer, that person is not suitable for testosterone therapy, definitely. But giving testosterone to someone who is low in testosterone after we have tried everything else like nutrition and weight loss and sleep apnea and managing sleep and exercise and all of that, that is not going to increase risk for prostate cancer, but the close monitoring is extremely important. Remember, Natasha, you talked about this gentleman who had high estrogen. You discovered the high PSA, right?
Right. Because I do a baseline PSA and we monitor it as
Yeah.
we
So that is my point. My point is just doing one or two tests and then putting them on, injection testosterone or gels or creams is not enough. That is actually doing a disservice to men. So that's the reason we do such a deep dive, because there is a difference between just taking hormones willy-nilly versus taking, safe hormone therapy. And that applies to men as well as women.
So
So
a quick comment here, and then we'll just end it at that. More and more we're finding out that it's the metabolites of testosterone that can influence the prostate and what happens in the prostate. And I published an article or a newsletter recently talking about xenoestrogens and how they have been shown in very small amounts to make prostate cancer grow. And so the talk, as we're talking to patients about prostate cancer and the risks of prostate cancer with testosterone therapy, we monitor the metabolites and we look for the things in your lifestyle that can actually increase your risk, but it's not actual testosterone by itself that's going to cause prostate cancer. The next, and sorry, just the final thing is now more and more that you're reading, they're saying all men end up with prostate cancer if they live long enough. Most men will have prostate cancer changes in the prostate at some point after age 50, and it's just a question of which kind. And you've seen all that stuff, right, Shabnam? So,
yeah.
this whole talk about testosterone and scaring men off, saying you're going to get prostate cancer, it's not accurate. We need to sit with you for a half hour, 45 minutes, and have that discussion about all the pros and cons and how and why, and then you get to decide, and then we get to monitor you closely anyway.
Yeah. So thank you very much, Natasha. Thanks a lot for the wonderful discussion, and thank you to all our listeners for investing your time with us. If you have any questions, I will add the email address to which you can send the questions, and Dr. Iyer and I will try to answer them maybe on another podcast or a video. And it's not just November, which is Men's Health Month. Men's health is every day, right? Bye now.
Bye. Thank you, Dr. Carr.
Thank you, Natasha.